last 2 decades. Bad road user, good road user, poor attitude and road rage. These are new terminologies in last 2 decades in this century. So West started taking it seriously, preventive steps after 1971. And the people there, especially sociologists, psychologists, and traffic administrators, indulged in research to prevent head injury. And in 30 years, they controlled it significantly, making their system and their infrastructure to such a way that they could bring it to minimum. So in last 2 decades, a new thing has come that more than 95% of accidents are due to road users' error. And road rage and aggressive behavior is a new thing which is being researched upon now after 2008, 2009. 2010 to 2020 was UN's decade for action for traffic injury prevention. So they requested many journals, editors to call for research related to this field. So there was no positive response, there was nothing. And in 2016, Staten, it was published in PLOS ONE, published a meta summary. They screened 8,560 articles of head injury traffic, and they found 18 articles from Asian countries, low and middle income countries, and only 3 were from Asia, which dealt with preventions of head injury. And there was no article from India. There is a society in India, Neurotrauma Society of India, which meets annually as a conference, and they give their guidelines or suggestions to Ministry of Transport, India. And in there is a guideline, there's a book. So they fail here that they don't understand the human behavior, how to change it. And violence in society, that is aggressive behavior, road rage, that too is not understandable by them, because this is a society of neurosurgeons basically. So 90 to 95% cases road users error, and there are other things also. So we did a study in 2017 in August, and a questionnaire were formed by clinical psychologist faculty at Delhi. They were expert in this field, and we found that aggressive behavior, the people were ready to indulge in violence, that number was 25%. Questionnaires were formed in such a way that any false answers are not there. So confabulation was negated. So the reliability was 99%. Surprisingly, out of 2, 1 female driver was ready to indulge in violence. So this is what we found in 52 patients. That was a flash study, just to pre-test whether we should carry out this study or not. So, and low frustration level, that is what they try to evaluate, low frustration tolerance. What is the status everywhere? Basically in India is that psychologists and sociologists who are responsible for changing behavior of the society, they don't exist practically in this field in India. Trauma surgeons, they are quite busy in management. They work on molecular level for management, but nothing, they are not interested in prevention. So literature has suggested for low and middle income countries what should be the short term approach, what should be medium term approach, and what should be long term approach. And these are available right after 2005, and we are not following them. So these things, pledges, warning, advertisement, punishment like photographs on cigarette packets or speed thrills but kills banners, they are counterproductive. There is ample evidence to show that. So India policing cannot help because we need 1 police per 150 person, which is available. Even US has 1 to 175. We have around 375 to 450. Exact number is still not known, but it is somewhere 450. Policing is not practically possible in India. 2008, it came, nudge theory came. So Thaler and Sunstein, they gave a nudge theory. That is, just show the example of few nudge theory. The Diwali Diya, selling Diwali Diya by an advertisement, or preventing crackers for in Diwali by showing a old man pampering his dog, or Maruti advertisement telling the child tells his father that I'm afraid. He tries to make faults in his car, father's car, so that he cannot go drive because he didn't use seat belts. So these are the examples of nudge theory. So this was in Amsterdam. Urinal was being spoiled regularly, so a photo of fly was made in the center of the urinal, and that prevented swelling of the toilet. That is nudge theory. So he got Nobel Prize in 2017. So after 2008, Australia, Singapore, Malaysia, these countries are using nudge theory for financial and healthcare policy making, and they are finding it very effective. Around the world, it is talked about. So we know enough evidence is available how to change behavior of the society, but it is a specialty of somebody else. We as a surgeons or doctors may not be capable of doing that. So you see that most of the low and middle income countries are wasting their money, resources and time on things which are not effective or counterproductive. So these are again the same thing, that these are being followed in our country which are not effective. So I came to Jodhpur in 2017, and then there was an innovation hub, or MOU was signed with IIT Jodhpur. So we with other departments like family medicine and psychiatry, we came up with a project, behavior change of society regarding traffic rule violations. And I was given number of Mayurakshi Chaudhary, she is Faculty of Humanities and Social Sciences, but she had other engagements to do. So she couldn't, I tried to pursue her a lot for a few months, but it couldn't become possible. So then we tried to do something. So we tried to pre-test a school, very close by school of Jodhpur, our campus. We gave masses, 5 masses to all children of 1 to 5 class. Helmet use, seat belt, overspeed, red light and fight. We set class teachers to give these 5 messages for 5 days, Monday to Friday. And then we evaluated use of helmet in parents. We didn't say anything to parents before that and after that. And surprisingly, it increased use of helmet in parents 22.5%, by 22.5%. That was surprising. Then we contacted head of the psychology and head of sociology of Jainan Vyas University, so that they can do something or help something. But I'm still waiting for their responses. I went to their departments that were completely deserted. I couldn't find anyone. Surprisingly, Dr. Alok in 2019, just before COVID, I have found only one person, Dr. Alok, he could initiative himself despite not being related to this field. So he tried to make people follow traffic rules in the campus at least. So with the help of administration, he pursued them to take out a notice which says that helmet use karo, seat belt pahno and speed mat chalo. So just before COVID, security guard died in 2019 in our emergency. So we are not aware because we do not deal with security guards directly. We know if a ward boy, sweeper or a nursing staff or a doctor dies because we interact with them regularly. And then COVID came. And then somewhere in August, I was called by my faculty colleague at AIIMS Delhi that traffic prevention, injury prevention week is coming. And then suddenly we got this news on 4th. I got this news on 4th of September that central student employee died. So that was not good. That was not a good feeling for all of us and our faculty, department's faculty also. Then we carried awareness programs with Dr. Naveen, Dr. Mahavir, Dr. Bharat to 3 schools, Rajmata School, DPS School and Mayur Chopasni School, because sitting doing nothing is not an answer. Maybe very small step, but we keep on trying to do something. And the response was very good. I don't know how effective it will be. So this is 13th October 2 p.m., a week back approximately. This is, if you remove the background, you will find that this is a highway accident. So Dr. Dushyant of anatomy, additional professor in anatomy, his car was hit by another car. So you can see the damage of that car. This is on this road, just outside the doctor's office. So he was using seat belt and another person was not using seat belt. So he got a laceration. Otherwise, there was no serious injury. This is the last CGR's photograph of our parking. So this is very common. I am pursuing people 1-2 daily for last 1.5 months, which is showing some effect, minor effect. Then I screened all the trauma journals of this month, current issue. 19 journals, top rated PubMed Index journals. And I screened all of current issue of all these journals. I could find not even a single article which talks about prevention. And then I searched the PubMed. The keywords were prevention, traffic accident, trauma, traumatic brain injury. I could find 2,578 articles. And I screened first 100. And I find 4 which remotely related to preventive steps and not from India, that all were from the West, all written by traffic administrators, sociologists or psychologists. In India, Delhi, Nilima Chakravarti and South, somebody works in traffic administration, and the neurosurgeon at Visakhapatnam, they have got few publications for prevention. There are other publications from India, from NIMHANS Bangalore, from AIIMS Delhi, and Safdarjung also, which talks about some other aspect, helmet use, how many helmets have been used by people, but not preventive steps. If you see 1990 and 2017, so many things are not grossly changing if you see the population burst. The only thing is 3.5 crore people die. Now, died in 1990, now 5.2 crore people die. The most important thing is the severity of accident is increasing. So this is shown by this data. So disability adjusted life years has decreased over that period. And same thing you will find in India. So all the parameters are decreasing, but the severity of accidents are increasing. So that is not a good thing. So death, initially 1 out of 10 die, 3-4 get disabled. Now this is increasing. So there are ample evidence that school children are the best people whom we can pursue, because one person, if he is convinced, he will change his whole generation, coming generation. So we need to make good road users in our society. That can be done by school-based program. There are ample evidence about it. So there are detailed technical details are there. How you can change this behavior of the society. Avian influenza, WHO had brought out a program of changing society behavior to prevent avian influenza in 2005. And they controlled it, Western countries in 2005. This who started this gave these guidelines. So the WHO has done it for other diseases, for other communicable, non-communicable diseases. So dangerous driving so behavior is the main thing. So recently Visakhapatnam Rajesh Pati, he is the only neurosurgeon from Visakhapatnam. And all other authors are from other countries. These 2 are from Sri Lanka, others are from UK. You can think that how much lagging we are in these steps. One single thing that is most effective is use of helmet. That has been found by many articles. Female, the thought perspectives are different, but the result is same. The number of accident, the severity of accident, death, disability are the same. This has also been done. We could have presented many things, many complex vascular skull-based surgeries, videos. But we do all those complex surgeries very effectively. Our results are no less than any other center in the world, because we work with these people who themselves are leaders. Even if we do something wrong, they bring out our patients. These nursing staffs are hardworking. They save our patients even if we do something wrong with them. So that is not an issue. So behavior runs in families like our departments, and then societies like AIIMS, then countries, and then the world. So forget about others, forget about patients, save yourselves. I'm not worried more for patients. I'm worried for my students, my faculty, my staff. This is the new campus of the road, new campus road. 1.6 kilometer beautiful road has been added. When I go in the morning to exercise, even I get attracted that if I get a two-wheeler, I will drive it very fast. That will give me thrill. So be aware. We are coming up with 1.6 kilometers of new road in the new campus. So try to understand read between the lines what I'm saying. Every day, if you can convince one person in the campus, that will help us a lot and save us from the calamity that happened. Making WhatsApp group for collecting money is nonsense. Prevent it. Don't do that. Thank you. If there is any question, please.
Very well said, sir, कि changing the human behavior is the most difficult aspect we face. And maybe because one is not convinced. I take myself in the COVID, where everybody told use mask, and I was not using it because I was not convinced that it is going to affect the spread, and which we have seen that in spite of wearing the mask, it has affected each one of us. So many times, what you rightly told, कि मुझे कुछ नहीं होगा, मैं हेलमेट नहीं पहनूंगा, सब एक्सीडेंट मुझे थोड़ी होगा. So that is the kind of the behavior, the denial that it will not happen to me is the main culprit behind the behavior which we saw. कि accident दूसरों को ही होगा, मुझे नहीं होगा. And that kind of the behavior, I think it is ingrained or somewhere we inculcated from the childhood. I don't know, or whether it comes automatically.
No, that was not their fault, because in our childhood, there was accidents were very less. The roads were poor. The good roads are double-edged sword.
Yeah.
So a normal that if you wear a helmet, that is considered abnormal. That you make it normal. Once you will make it normal, that not wearing a helmet becomes abnormal. So everybody looks ki helmet nahi pehna hua hai. If you bring that situation in our campus, it will, because 1 in 1,000 every year has to get an accident, and 1 out of 10 of these people will die. Our population is more than 1,000. I know it is around 2.5 thousand. So every year we are going to get 2.5% caught in will get in accident, and then in 3-4 years we will get 1 death.
I agree. So absolutely agree. And
this is a number. This is the data, Indian data.
And we have to change behavior. There's no doubt.
In 2017, 187 people died in Jodhpur accidents. Now it is around 400, 387 till now in this month. So in coming till December, it will go beyond 400. So number is increasing. So make it normal.
Speed, vehicle type, roads, everything, scenario is changing. Our vehicle now more speedy, more fast they go. Because as you shown in front of the this
administrative block,
the kind of the damage, I think this would have been done or happen in the highway with the great speed, and the kind of the damage I see, I think that they both were not driving at the normal speed, because this damage cannot occur at the speed of 10 and 20.
So Dr. Alok failed because one has to the studies show that you have not to humiliate or scold.
Yeah.
You cannot do that. If you do that, then again policing comes.
Yeah.
So you have to convince them with some other means, not scolding, not humiliating or insulting. Yeah. So Dr. Alok somewhere couldn't do that.
Yeah.
So that's why I also started doing that. But I try to request people. I don't know if we look after our department only, that will be big help. I have requested many head of the departments. I know which department is the biggest violators. I have all the photographs, I have all the data. I study it everywhere. Whenever I go, I study schools, I study campus, high school roads. So I have 1920 schools photographs during morning. So I have thousands of photographs of AIIMS this campus, thousands of traffic rule violators, talking on phone without helmet, smoking, talking on phone, everything together. I have got all the photographs. So that is not to demean or to insult people.
No, that's agreed that, this is the preventable,
Take care of your departments.
Yeah. We always talk of the prevent cancer, prevent heart disease, prevent diabetes, so on and so forth. But
this is completely preventable.
Yeah, this is completely preventable, yes. Wonderful, sir. And great initiative, and keep it up, sir.
So you've rightly targeted the right population of trying to get children on board and trying to bring changes in society from within, but it's going to take 20 years for them to really...
No.
Maybe 10 years.
No. They change their parents.
Right.
They change their relatives. They change their friends.
Right. Even though the change was from 2% to 14%,
that was only for...
It was...
literature so suggests that if you target the children, they change the society. That doesn't take time. Because the parents listen to their... We try to talk to many people, many school principals, administration in 2017-18, Dr. Bhaskar and me, Dr. Mang. Somehow the school administration thought that perhaps we are trying to find faults in them. So we couldn't convince them to carry out this study in a proper way. So targeting children, there are enough literature. You go through run through the literature, go through literature. This suggests that society changes because a child of 8th class or 9th class, they become drivers in 3-4 years. So they start influencing everyone around them, their family, their distant family relatives. They change everything.
So that's one way of bringing about change. Do we also need to think about bringing about change at multiple different levels? Like licensing in India is notoriously lax. You don't even need to go to the licensing authority to be able to get a license. So is it the time to try and convince those stakeholders that it is a multi-pronged strategy that is likely to work rather than one particular area of targeting?
2 days back, just before Diwali, one state chief minister has announced that, forget about licensing, had announced that Madhya Pradesh or some Chhattisgarh, that all traffic rule violators will not be punished. 2 days back. Forget about actions taken by others. Forget what we can do or accept the situation as it is. Try to change whatever we can do. That's all. Forget about it. We keep on doing. Every neurotrauma conference, for last 7-8 years, I'm attending regularly. And every year, the licensing issue is there. In all guidelines. That psychological evaluation licensing, there's no doubt about it. The people who work in the field of psychology or psychology specifically, they are able to identify that these are the people who can create damage on the road. There are many techniques. Dr. Naresh will be able to tell me better. But there are questionnaires, there are methods that they can identify, pinpoint that this is the problem, he will create problem on the road or not. So they keep on doing it for other conditions, not for traffic accident prevention. So things are already existing.
Sir, a wonderful presentation, and this topic is very close to my heart. In 2014, myself, Dr. Rajkumar, the neurosurgeon and former director AIIMS Rishikesh, and Dr. Rajneesh, who is heading the Department of Neurosurgery Rishikesh, we did a study in 2014, which was published in 2016. And this study was done on 100 medical students and 50 nursing students. And we tried to assess their knowledge, attitude, and behavior for traffic safety. And what we found, what Dr. Naveen was highlighting, that 84% of them were using two-wheelers and only 3.3% of them were having license. And other surprising thing is that, large number of them were not using helmet, around 57%. And around 62% were not using seat belt. And we recommended at that time in this paper that we should go and talk to policymaker. And one more surprising results in this study is that only 2% of them had a formal training for driving. And when we learn ourselves, we only know how to manage this vehicle, but we do not know about basic rules of traffic and to behave properly. So we have recommended in this that we need to talk to these license issuing authorities to have a formal training into their own system and then issue the license. So regulation strictness, and we have also talked about nudge theory at that time, that we need to have awareness, and you very rightly hit the nail that we need to target the school children's. So we will be changing behavior for future generation, and they also can influence their parents very hugely. So sir, congratulations, and I'm always there to partner with this such initiative. And I think at least our campus, we can have a change into behavior, and then gradually we can.
I don't want to lose any one of us.
Yeah.
I'm not worried for outside campus now. So I don't want to lose any, because it is painful. We see deaths day in and day out. But when somebody who comes every day to you to get files signed or work something, that remains in our memory unknowingly for weeks together, months together. So those are painful things. So we shouldn't do that. So I don't want to lose any one of us whom we know in the campus. So I'm purely concerned only about, there are many issues in the state, in the country, I know that. But this is what we have to accept the way it is. This is beautiful country.
On same direction, a order is issued. We made it mandatory at our entrance gates, all the gates, where security guard was very politely requesting that it is nice that you use the helmet. And gradually within 1.5 years, it took 1.5 years for us that everybody, even the driver and the person who is sitting at back, they started using helmet. The people who are going out and coming inside.
67% of security guards of our campus don't use helmet. Forget it. Now I keep on pursuing them for last month, at least when they see me, they put on the helmet. I don't scold them. I just request them, if you do this, that is not acceptable. I keep them saying this. So others will not do it. It is better to convince one person at a time. If that security guard is able to follow that, he will not perhaps die. I don't want him to die. And then his children will learn that his father is putting on helmet. So he will also start putting on helmet. So I want to target one person. I do it daily. I target it 5. I do it 1, 2. I tell somebody someday 1 person, someday 2 persons. So I have stopped many of them, these students. I request them. Whenever I move in the campus, I lower down my windows glass and stop them and request them. So many of these sitting here, I have requested them. So I don't know. I hope that they will follow. I don't want to lose any of them, because they will change their parents, that their children will become users. So I look for long-term perspective. Forget about outside patients. Thank you.
Thank you, sir, for the initiative. Sir, related to the school things, so most of studies in most of areas, including this, tells about some or other change, because the good thing is they are receptive, and again, they are also trying to change their parents, themselves, as well as the peer groups. The good thing is if it goes in some or other way, the regular teachable approach through the teachers' curriculum, because the researchers don't go that frequently in the schools. But yes, if some or other modality works, then it's amazing. And again, India is proud to have this population greatest compared to the other parts of the world. About 50% of population is below 18 in this. Second part, sir, since now for last few months, neurosciences group as well as other groups have started some. So this can be taken up. And again, like this nudge, because what happens in other parts of research as well as this, talking to someone and then many people don't approach back. So in that way, a couple of people have tried some initiatives from different parts as well as different departments. So under your leadership and again guidance, we can definitely take up for Jodhpur. Thank you.
Actually, schools are counterproductive. Their teachers, their guards, their drivers, no one follows traffic rules. So if you send your child to the school, maybe he will learn the opposite that you want him to. For regarding traffic prevention, so I have studied them. I can tell you percentage of the staff of different schools, 6, 7 schools. I have screened their staff too. So it is rare to find their teachers, class teachers, they don't use helmets while using two-wheelers. Most of them. So forget about it. Yes,
Good
ma'am.
morning, sir, and thanks for such a beautiful presentation. And I truly appreciate that, we see at AIIMS that this is like top of pyramid, and people at top of pyramid concerned about like so many issues of public health. It is amazing, and I have been working quite a bit on the pre-hospital aspect. So we have used certain behavior change theories, and it has brought us a lot of insight. Like one aspect which I would like to share is from our own small studies we have been conducting is that before behavior change comes intention, and we have been seeing that it is not simply there's a behavior aspect, there's more of an intention aspect, there's more of social norms aspect, and we would like to partner because we have got this insight that behavior is not something, a single aspect, it is a multifactorial aspect, and this is like such a important topic. And our understanding of public health or our understanding of community has shown us that only single aspect or nudging aspect do create a difference, but it is not long lasting, because attitudinal change is a huge thing which everyone
I'm
of
not.
us needs.
We are not an expert of this. So there are people who are expert of this.
So, but-
I'm again and again highlighting. I'm not concerned about anybody else. I'm only worried for our people.
Yes, sir.
The bottom line is this. I don't want to go into the anything. Treatment. 70 to 80% of our beds are occupied by head injury patients. We can't operate good, difficult cases. They are referred to other places, and we are managing them. And who manage them? Our medicine, surgery, anesthesia people. We do nothing. I'm not interested in pre-hospital, hospital, or post-hospital at all. I have no interest. So I try to focus on that. कि इसको रोकें कैसे? वो अगर हो पाए, I'm not worried. Now I'm not worried. Before 2018-19, I was worried for the country, state, and world. Now, for last few months, I'm not worried about outside. I'm worried only for our people. And 10,000 people in 5 years, 2,000 population of our campus around, 5 years we will lose one. Definitely, at least.
Definitely, that's an estimate we can consider.
So I want that
going on
that thing not to
accident
happen.
rate. Thank you, sir.
Thank you.
चलें